They should be done under the guidance of a medical professional because the vitamin E doses that are used in the studies were higher than those we would typically recommend, and vitamin E does have some toxicity. So the treatment of fatty liver disease really involves significantly changing your diet and losing weight. And the good news is, just as an increase in weight increases your risk for fatty liver disease, decreasing your weight significantly decreases the risk. And incorporating more fruits and vegetables into the diet, which contain important nutrients that can help the liver to heal, as well as losing weight, are really the mainstay, the sort of cornerstone of therapy. But there is promising new data also for vitamin E supplementation, and there's data that suggests that can help to halt the progression of fatty liver disease from the original deposition of fat to the inflammatory stage. And that's very, very promising news. There was a study from the Cleveland Clinic, a major Japanese study, and also a study in the New England Journal of Medicine. They should be done under the guidance of a medical professional because the vitamin E doses that are used in the studies were higher than those we would typically recommend, and vitamin E does have some toxicity. But I recommend getting vitamin E from foods. So avocados, nuts, and green leafy vegetables are great sources of vitamin E, and they also will help with your weight loss efforts. So that's another way to approach it. Finally, for end-stage liver disease, if your fatty liver progresses to cirrhosis, liver transplantation is really the only option there. And unfortunately, end-stage liver disease can be fatal if not treated. Liver transplantation is an incredibly overwhelming procedure to have. The surgery itself is major. It involves taking significant drugs for the rest of your life, having a lot of monitoring and maintenance. There's significant risks even after the liver is transplanted, risks for infection and suppression of the immune system. So this is not something that we would recommend somebody go into lightly. And by far, the better option is to try through dietary modification and exercise to reverse the liver disease when it's still in the reversible stage. Exercise is helpful not just as a way to help you lose weight, but it helps with insulin resistance. Insulin resistance is a major risk factor for fatty liver disease. Studies have shown that 30 to 60 minutes of vigorous exercise every day can really help with insulin resistance, and even if it doesn't result in significant weight loss, can still help to treat fatty liver disease.